Now in this part of the video we will discuss the facial aspect of the cranium, and the features of the anterior or the facial, that's the frontal aspect of the cranium, are the frontal and the zygomatic bones, the orbits, the nasal region, maxillae, and the mandible. So the frontal bone, specifically the scamus, the flat part, forms the skeleton of the forehead, articulating inferiorly with the nasal and zygomatic bones. In some adults, a frontal suture persists. This remnant is known as the metopic suture. It is in the middle of this is known as the glabella here, and this is the smooth, slightly depressed area between the superciliary arches. So the intersection of the frontal and nasal bone is the nascian, so which is the most people it is related to a distinctly depressed area, and this the nascian is one of the many craniometric points that are used radiographically in medicine to make cranial measurements, compare and describe the topography of the cranium, and document the abnormal variations. So the frontal bone here, it also articulate with the lacrimal here, the ethmoidal, and the sphenoids. A horizontal bone portion of this bone, the orbital part, forms both the roof of the orbit and a part of the floor of the anterior part of the cranial cavity. Now this is the supraorbital margin of the frontal bone. This angular boundary between the squamous and this orbit part has this here is known as the supraorbital foramen or notch in some crania for passage of supraorbital nerve and vessels. Just superior to the supraorbital margin is a ridge, and this is known as a superciliary arch that extends laterally on each side from the glabella. The prominence of this ridge deeps to the eyebrows and is generally greater in males. This zygomatic bone, this is also known as cheekbone or the mallar bone, this is forming the prominences of the cheek, lie in the inferolateral side of the orbit and rests on the maxillae. The anterolateral rims, walls, floor, and much of the infraorbital margin of the orbit are formed by these quadrilateral bones. This small zygomaticofacial foramen, this pierces the lateral aspect of each of the bone, and this zygomatic bone articulates with the frontal, the sphenoid here, and the temporal bone, and here the maxillae. The inferior to these nasal bone is the pear shaped piriform aperture, the anterior nasal opening in the cranium. So the nasal septum can be observed through this aperture, dividing the nasal cavity into the right and the left parts. On the lateral wall of each nasal cavity are these are the curved bony plates, and these are known as the nasal conchae. Now the maxillary, this forms the upper jaw, and their alveolar processes include the sockets, this is known as the alveoli, and this constitute the supporting bone for the maxillary teeth. The two maxillae are united at the intermaxillary suture in the median plane, and these maxillae surround most of the piriform aperture and form the infraorbital margins medially. Now they have a broad connection to the zygomatic bone laterally and infraorbital foramen inferior to each orbit for passage of the infraorbital nerve and the vessels. And now let's talk of the mandible. Now you can see here it is a U-shaped bone with the alveolar process that supports the mandibular teeth. It consists of the horizontal part, this is the body, and here the vertical part and the ramus. The inferior to the second premolar teeth are the mental foramina for the mental nerves and vessels. So now here is the mental protuberance, this forming the prominence of the chin, and it is a triangular bony elevation inferior to the this mandibular symphysis. the osseous union where the halves of the infantile mandibles fuse. So now in the next part of the video, we will be looking at the other aspects of the cranium. That was all about the that was all about the facial aspects of the cranium. Thank you.